Hello, everybody. I'm Laura Pohl. I am Senior Clinical Consultant for Cancer Choices. I'm a longtime oncology nurse, and I am joined here now by Lindsay McDonald, who calls herself a cancer thriver. I'll let her tell you a little bit more about that. She is a volunteer site guide for Cancer Choices and a cancer coach and an author of a book about her cancer experience. And Lindsay, we've done talks together before, and in recent months, you have really become laser focused on the problem of fear in people with cancer. And I read this quote by Dwight McKee saying that the greatest enemy of the person with cancer is fear. And it reminded me a lot of what you said. So since we're talking about managing side effects and symptoms, with anxiety being one of them, maybe you could talk a bit about this fear and how oncology nurses can work with you all with that.
My pleasure. And to all of you out there, thank you for the job that you're doing. Without you, this would have been a much harder journey. So fear. I would say 99% of the people, the patients that you're dealing with, have an overwhelming sense of fear at different points in their cancer experience. Obviously, at diagnosis, progression, first time they get an infusion, pleural effusion, and you land in the hospital and you are fully scared again. Waking up in the morning with a pain that you don't understand, and that can just re-trigger all of the fears that you have. In fact, in that one, you sit with it for a couple of hours. You decide, is this something I need to let somebody know about? If it clears up, maybe not. If it doesn't clear up, we are in high gear trying to get to a doctor or to someone who might know a little bit more about it. And the thing about fear that we carry is it blocks making good decisions. It blocks making non-panicked, clear responses. And when we're in fear, we have a hard time listening. Even if you're saying all the right stuff, without us calming down first, it's hard to remember everything that you say. Some of my best experiences at the beginning of my journey, and my journey's been 10 years long. I'm still full of cancer. It's not going away. I've got 2 kinds of cancer. But some of the best experiences have been when I've been with the oncology nurses, and we've talked, and they've seen me as a person. They've gotten to know me. At where I go for treatment, it's always the same nurse or one or another. Maybe there's 2. And that is a relief to me because I know that when I'm talking to them, they kind of know me. And honestly, a little laughter in that talk is also a wonderful thing. You guys also help with us when we need to ask something of the doctor. Very often it's very hard to get to the doctor, but we all have my chart, and usually it's an oncology nurse that's manning the other side of it. There have been plenty of times when I've asked, hey, can you ask the doctor this question? Or do you know anything about this? Because I can't get to them right now and I need some help. And the minute they say, sure, I will ask for you and I'll get back to you, my anxiety level goes down. And it's so very important that we are not living in anxiety all the time. I mean, even for someone without cancer, that's important. But for someone with cancer, as I'm sure you know, stress is changing our cells and it's taking our life away. I don't mean to death, but I mean who we have been, because we're all flooded with that. And being recognized and comforted and as a partner, with us, as opposed to just a caregiver, makes an incredible difference in feeling safe and feeling like, okay, I've got somebody on my side who sees me.
Beautiful, Lindsay. Thank you so much.